In this patient with a pre-existing posterior capsular rupture, the posterior capsular tear edges are fluttering and appear straight. This indicates that the anterior hyaloid face is intact. The intraocular pressure settings are low, promoting a fluidic environment that is favorable for preserving the anterior hyaloid face. I have no financial interest in the use of active fluidics, which helps maintain chamber stability. The Flutter Sign enables real-time decision-making, allowing the continuation of AHF-preserving surgical maneuvers. I have retracted the irrigation aspiration sleeve to minimize the turbulence of balanced salt solution against the anterior hyaloid face. The size of the PCT remains unchanged from the beginning of the surgery. ASOCT image of the patient confirms the presence of a pre-existing PCR. Intraoperatively, the posterior capsular rupture is identified and observed that the tear edges are motile and demonstrate the Flutter sign. The PCT margins are straight, further supporting the integrity of the anterior hyaloid face. At no point during the procedure does the fluttering cease, indicating that the AHF has remained consistently intact. The use of low fluidics is friendly to the anterior hyaloid face. The chamber settings are stable and there is no turbulence which can be hazardous to the integrity of anterior hyaloid face. The AHF continues to act as an ally. The PCT edge can now be gently rounded due to the preserved anterior hyaloid face. Triamcinolone staining confirms the absence of vitreous in the anterior chamber. In this video of a case with PCR, the PCT edge is clearly fluttering. A physiological IOP of 20 mm of mercury is maintained. Small nuclear fragments are seen floating in this stable environment, while a larger fragment is being emulsified. These smaller fragments continue to rebound from the intact anterior hyaloid face. Small nuclear fragment is successfully expressed with the AHF remaining intact. Now, the second small fragment is also expressed. In this case with PCR, the posterior capsular tear edges are scalloped and non-fluttering, which indicates ruptured anterior hyaloid face and vitreous prolapse. Limbal vitrectomy is performed and intraocular lens is implanted.